Basic life support, or BLS, is intended to slow or prevent damage to an unresponsive person until advanced care becomes available. The goals of BLS training include initiating the chain of survival, learning CPR, and how to use an Automated External Defibrillator, or AED. In this video, we will demonstrate how one rescuer responds to a collapsed or unresponsive person in an emergency situation. Before initiating the chain of survival, a rescuer must first determine the scene safety before approaching a person during an emergency. Check for water, electrical lines, or anything else that could further compromise the person or yourself. Once the scene is clear, begin the BLS survey to determine which actions to take next. Check to see if the person is responsive. Tap their shoulder and loudly ask if they are okay. If the person is not breathing or insufficiently breathing, send someone to call emergency response services and to retrieve an AED. If alone, call emergency services and use your cell phone speaker to keep your hands free. Do not leave the person alone. Simultaneously check for breathing and a carotid pulse for at least 5 seconds and no longer than 10 seconds. If the breathing is not normal but the person has a pulse, provide one breath every 5 to 6 seconds and assess their pulse every 2 minutes. Begin CPR if the person has no pulse and is gasping for air or not breathing at all. Start cycles of 30 compressions and 2 breaths. Start by placing hands on top of one another on the lower half of the sternum and centered on the chest. Provide high-quality delivery of chest compressions of about 2 to 2.4 inches or 5 to 6 centimeters deep at 100 to 120 compressions per minute. Allow the chest to recoil entirely between chest compressions to allow the heart to refill. Stop after 30 compressions. Use the head tilt, chin lift maneuver to open the airway. Use the jaw thrust maneuver if a neck injury is possible. Give a breath and deliver over 1 second while watching for the chest to rise. Repeat while giving a second breath. Resume chest compressions, minimizing interruptions. Continue administering CPR until EMS arrives or the person's condition normalizes. In a situation where a person is not responding to CPR, rescuers may use an AED or Automated External Defibrillator to deliver a shock to the person's chest to restart the heart's normal rhythm.
If you enjoyed this video and would like to learn more, check out our Medical ProCerts video library on YouTube, or if you would like to certify in ACLS, BLS, PALS, or CPR, simply register and certify online today at www.medicalprocerts.com.